Can you talk a little bit more about your work, sort of connecting libraries with the work that goes on in public health?
When I was in library school, I basically had an interest in public health, but I did not have the money to pursue an MPH or move. I was working at the University of Rhode Island, and one of the benefits of working there was that you could get a very low cost master's degree. And my creative mind said, I will get a master's degree in library science and use it to immerse myself in public health. When I was in library school and out of library school, initially, I was implementing public health programming and I realized I did it all wrong. I started with an interest and then implemented my program and had very simple surveys, but that's not the right way to do it. If you're a public health person, which you are, you know the right way to implement a program so that it's grounded in evidence and is most likely to have the greatest impact. And I realized, particularly through my coursework at Emory, that there's a real opportunity to connect with other librarians who might be in the same mindset that I was. I have a great idea. It's novel, it's new. I think there's a need. Let's go ahead and do it. But I can jump in and say, yes. And also, let's make sure that there's a need and let's make sure that we're connecting with the right public health professionals because they have different experience and context. And also, public health people, let's bring in librarians as much as possible because they are part of critical public health infrastructure. They're interacting with some of the hardest to reach people every single day. And I think there's a really important opportunity to connect those two worlds as early as possible and to give librarians, especially, the tools to help make those connections. And if they don't have access to a public health professional, they can start implementing programs through a public health lens.